Hi everyone, my name is Philip Waters. I'm the General Manager at Deaf Victoria. I'm deaf myself. I was born deaf, raised deaf. I have signed my whole life. I think it's important to make sure that the information is done in a visual way, that healthcare workers can validate that the deaf person or hard of hearing person understands the message. They use various ways to communicate, such as writing it down on a piece of paper and then getting the deaf and hard of hearing person to use that same form if they can. Perhaps making sure that the person who's communicating with the deaf and hard of hearing person is able to then communicate with other healthcare workers in that space to ensure that everyone's aware and what types of supports are unique for that person. If a person's wearing a face mask, that they remove the face mask when communicating with deaf and hard of hearing people. Be friendly and patient, encourage them to use an Auslan interpreter. Often I've seen people think, well, look, we don't really need an Auslan interpreter for this, it's too much trouble, it'll take a while, it's a bit of a burden on the healthcare worker, there's so much to manage. But I think it's important that we are proactive and say things to the deaf and hard of hearing person like, I've organised an Auslan interpreter for you for the consultations that you have coming up. And that shows that you're able to be show care for the deaf person, and you're able to demonstrate that you've done that by showing them something on a computer or a phone which has the email that's confirmed the Auslan interpreter's been booked. Sometimes healthcare workers don't know how to make bookings, and as a result they might be resistant to that process, but never use a deaf person's family member or relative or friend to interpret for them, ever. In particular in healthcare settings, it should only be done between an Auslan interpreter. They do. So I have a hearing aid and I wear a hearing aid, but I still use an Auslan interpreter regularly. There's a common myth that the more deaf that you are, the less you can lip read. But that's not true. There are some people who are have mild levels of hearing loss that aren't able to lip read at all. And then conversely, people who have profound hearing loss are able to lip read quite well. So it's very specific and individual. So hearing levels and hearing losses doesn't then correlate to a person's ability to lip read. The average level of deaf and hard of hearing people, their literacy levels are somewhere around grade 4 to grade 6 of their hearing counterparts. As generally speaking, could be level 8 or 9 for reading. For deaf and hard of hearing people, it's somewhere around that 4 to 6. So it means that we need to ensure that the English literacy that we're using, or the English language that we're using to communicate with deaf and hard of hearing people, is in simple English and easy to understand English with words that make sense. Because if we're using language that doesn't make sense and it's beyond their literacy levels, then there are implications to them not understanding the message.